Often I'm with these men when they're actually diagnosed with prostate cancer, and many of them, when they're told, are in complete shock. And the first thing they'll say to you is, I really didn't think I was coming in to be told this. I thought I would have just been told that the biopsy was fine and everything's okay. We're in an extremely privileged position to be able to support these people and their families at one of the most stressful and vulnerable times of someone's life. My name is Sonia and I'm the Prostate Cancer Specialist Nurse here at Golden Valley Health in Shepparton. You know, there's been people looking after people with prostate cancer and all different cancers for many, many years. And we're not here to duplicate those roles. So we're not just supporting them at one stage. We can be a central point of care right through their whole journey.
My name's Caruso. I'm a prostate cancer nurse at Eastern Health. Previously I was a urology nurse consultant for about 12 years. As a urology nurse, you kind of just see patients during that surgical pathway and never really saw them at the end of their journey or kind of what happened to these guys. I thought, you know, that's a really big gap that you're missing. When these roles came up, I thought what a great opportunity to be able to be at the first diagnosis all the way to end of life care. So I think it's given these men and their families the opportunity just to call someone, develop a rapport with someone knows their history, what's happening. All the men that I kind of have contact with say how beneficial the roles have been.
Mel was very good. She explained everything in layman's terms. She was always there with any questions I had. I didn't feel embarrassed about anything. You know, she made me feel at ease.
Sometimes your involvement with the family can actually even be more than maybe you're having with the patient. And you do become, I suppose, a part of their family.
I was probably a little bit lost not knowing where to go and what was next after Dad's diagnosis, but they just keep steering me in the right direction and also helping me in the way that there's help for me if I need to talk to someone. And every time Dad comes in for his appointment, they come in and they speak to Dad, and that before he's even in here, and just check how he's going, and not just physically but mentally as well.
And they say if I have a problem, ring them up anytime. Yeah, they're absolutely sensational.
When you're told you've got a cancer diagnosis and your whole life's turned upside down, and I suppose you do look at your own mortality, and it's really nice to see them come out the other side, and you'll run into them down the street and, you know, they've gone off, they've been cured, they've gone on with life, and they're just so appreciative of having that local support and that go-to person.
It's a real privilege for us to be part of these guys' lives.